So my name's Miles Levy, and I'm a consultant endocrinologist at the University Hospitals of Leicester NHS Trust, and I'm an honorary associate professor at the University of Leicester in my sort of academic role. Why did I decide to do medicine? Well, I don't know. I mean, my father's a dentist, and I was pretty good at science at school. But if I'm honest, I don't think I had an early vocation. I found it really interesting, and a bit like a fine wine, I find it gets more interesting every year, and I love it. But I'm not sure that whether I had thought it through, apart from having a fairly childlike interest in medicine, how the body works, and actually endocrinology from quite a young age. But whether I knew that it would work out was more by luck than judgment. Yeah, so why I chose endocrinology goes back to a chap called Dr. Applin, who was my rather eccentric biology teacher when I was about 13 or 14, and he would speak about the pituitary gland being the conductor of the endocrine orchestra, and I found that quite captivating. And he was obsessed with the embryology of the pituitary gland and the hypothalamus, and I became really interested in it from then, actually, and I read books about it. I did really well at school, and then when I was at medical school, it just so happened that my mentors were endocrinologists, and when I was a junior doctor, all the people that encouraged me and that I wanted to be like were endocrinologists. So the wind was always blowing in the direction of me doing endocrinology if I did do medicine, and I have absolutely no regrets. It's a fascinating specialty, and I'm really privileged to be involved with the Society of Endocrinology to try and sort of make a difference nationally as well as locally. So it's a really, really fascinating, interesting subject, actually. So endocrinology is a fascinating subject because if you get the diagnosis right, you can make patients better almost 100% of the time. And if someone has too much of a hormone, if you find out where it's coming from and lower it, the patient will be transformed to normal. So for example, Cushing's syndrome is a condition associated with increased steroids. And that can come from numerous places in the body. And if you get the diagnosis right through blood tests and scans, you can totally transform their physique and mental health to normal in the usual situation. If someone has too little hormone, you can replace that and patients can feel better within hours. For example, if they've got low steroid levels, it will completely change their life by giving them steroids. If they have a condition called diabetes insipidus, if you give them desmopressin, they will stop peeing and they'll get a good night's sleep for the first time for years. And if we diagnose tumors in patients, we work very closely with surgeons, and almost invariably those tumors are benign, they're not cancer. And so often we break good news, we don't break bad news. And most of the time in endocrinology, we have a very satisfied patients, and it's very satisfying to have a long-term relationship with patients, and it's a cradle to grave specialty, and I find it very fascinating. I'm always trying to convince the junior doctors that it's the best specialty to do. You'd have to ask them, I guess. I mean, I hope that I'm approachable and thorough. I do pride myself on having a good relationship with patients, and some patients have become very good friends and are in touch. And so I hope they find me approachable, friendly, with a good bedside manner. But most importantly, I hope they think I'm a good endocrinologist, because at the end of the day, they're here to be fixed up. And it's all very well to have a good bedside manner, but you also need to be seriously good at your subject. And whilst I wouldn't want to call myself good, I'd let others speak for me. I hope that the patients think they're getting a good deal when they come to see me, and I hope that they leave the consulting room happy and feeling like their concerns have been listened to, but equally that I've done the right thing.